the issues that are presented. We've been very generously supported by U.S. government agencies and international health agencies as well, and have collaborations with many organizations around the globe. What I'd like to do, Dr. Solomon talked about the epidemiology, and what I'd like to show you is how this is something that's been changing and evolving, because it's really quite important as we think about how to improve cancer care around the globe. If you look at countries from an economic perspective, low income, lower middle, upper middle, and high income, this has many ramifications. It relates to how long people live, and that is going to affect how many breast cancer cases that you see in low-income countries, where people typically, the average longevity is under 60. You're not going to see as many breast cancer cases because breast cancer becomes more common as women get older. But you can also see that there's a huge variation in investment in health care. And that also is going to relate to differences in outcome. And we're going to walk through how these differences manifest. There are a number of myths that are very commonly voiced in the world community. One of them is that cancer is really an insignificant issue for low and middle income countries, when in fact cancer is the second most common cause of death in low and middle income countries, more than respiratory diseases and infections, more than HIV/AIDS, more than diarrheal diseases and tuberculosis. Here is the data from the New England Journal of Medicine illustrating where cancer stands in terms of mortality around the globe. So actually, cancer is becoming the most common cause of death, and it certainly is something that we need to be considering. Another common myth is that breast cancer is really only an issue for countries of wealth, when in fact, breast cancer is the most common cancer among women around the globe, and it is the most likely reason that a woman will die from cancer. It's important to distinguish between incidence of cancer, how many cases do we find, which of course relates to whether we actively screen and look for the disease, versus mortality, how many lives do we actually lose. If you think of that ratio of mortality to incidence, which we saw earlier, that gives you an idea of how well we do, how many deaths versus how many cases are diagnosed. And what you can see is that there's a huge variation. So in North America, where I come from, the ratio of deaths to incidence is about 1 in 5, where in Latin America, middle-income countries, it's about 1 in 3. In Africa, it's 50-50 or worse. Certainly, there are many parts of the world where breast cancer is largely a death sentence.